Hello, everybody. An absolute pleasure to see you all here for our first of, I hope, many talks from our expert, distinguished speakers over the coming months ahead in the data science and machine learning field. We are absolutely delighted to have both our current data science, machine learning, DSML, we kind of call it the shorthand, residents. I can see Margaret, I can see Paul, Kevin, Ryan, Natalie, Sylvia, wonderful to see all of them, some of our team as well, our brilliant data science, machine learning residents, our faculty for that program. I can see Jonathan, Alex, and Laura. I do feel honored, absolutely honored to welcome our speaker today, Professor Gerard Torrats-Espinosa, who is going to share with us a talk on the work they've done using machine learning to evaluate COVID-19 outcomes in the US.
It's a pleasure to be here. As Will has briefly mentioned, I've had the chance to see the development of the DSML program from outside and from inside, and it's incredible what's been built in CodeMate. So I look forward to seeing how things keep progressing and getting bigger. I want to thank Will and the team for welcoming me here and giving me a chance to present this work. I'm very passionate about this work, and I hope that in addition to showcasing the power of the methods, I'll get some people excited to pursue some interesting social science questions that can be tackled with these methodologies. I'll share my screen and I'll be talking over a few slides that I've put together, if that's okay for everyone. So this is a study that was published relatively recently in the Proceedings of the National Academy of Sciences. To give you context for where the study began. So I'm going to take you back to the spring of 2020. Besides, a few of us had the privilege to have to only worry whether we have to wipe down the groceries after we bought them during COVID time. But there was a more important emerging trend happening, which is that Blacks and Hispanics were hit harder by COVID. However you cut the data at the city level, at the neighborhood level, Democratic states, Republican states, Republican states, you'd see massive disparities in COVID mortality between Blacks, Hispanics, and whites. There were several journalistic accounts that pointed to higher infection rates and mortality in racial minority communities, and evidence that was coming from the few cities that at the time were publishing race-specific data on mortality were showing massive overrepresentation of minorities among the deaths. So, for example, in Chicago and Milwaukee, 70% and 73% respectively of COVID deaths had been among African Americans during the first few months of the pandemic. At the state level, states of Louisiana and Michigan, for example, 70% and 40% of the deaths were among Blacks. If you look at the proportion that Blacks and African Americans make of the population, these figures are severely overrepresented. So it was a clear point towards massive racial disparities in COVID outcomes, both in terms of deaths and infections. There was some reason to for that to be happening. So there is existing evidence from other studies that Blacks and Hispanics are more likely to experience the pre-existing health conditions that we knew at the time were making them more vulnerable to COVID-19. We also knew that Blacks and Hispanics were overrepresented in the jobs that had been classified as essential, so they had to be working, even though the virus was circulating, not under control at the time. We also know that racial minorities are more likely to live in multi-generational households, which means that the elderly are more likely to be exposed to the virus if younger cohorts are interacting with other people at higher rates, for example. We also know that racial minorities are less likely to have health insurance, which exacerbates any risks that they might be facing around COVID. We also know that they live in neighborhoods that where essential establishments like pharmacies, grocery stores, supermarkets are more scarce. So they probably had to travel longer and be exposed for longer periods of time to the virus, maybe taking the subway to get their groceries, things like that. And we also know from sociology that, given the institutional barriers and discrimination that they face across several contexts, Blacks and Hispanics might be reluctant to seek medical care if they fear that interacting with the public health system might reveal something that they're afraid of. For example, if someone has an arrest warrant, that person is likely to show up at a hospital because he or she might fear that might trigger an arrest. So a bunch of both individual level risk factors and structural conditions that make those racial groups more likely to be experiencing COVID at higher rates. If you overlay on all of these what we know about the spatial distribution of Blacks and Hispanics and racial minorities more generally in the US, the case for studying segregation as a potential explanation for why we saw these massive disparities in COVID outcomes, I think, starts to make sense. So racial segregation means, higher likelihood of experiencing social isolation. We also know that from existing research in sociology as well, that friendships and social interactions are defined along racial lines. So Blacks are more likely to interact with Blacks and whites are more likely to interact with whites. We all have a very diverse group of friends, but people in this call are not representative of what's happening in the United States overall. So there is this, with sociology, we call this term homophily, the idea that social interactions are more likely to happen within the same racial groups. So here I show 3 hypothetical scenarios. So A, B, and C. In each of them, there are 100 squares, each of them representing one household. 80% of the households are white, and 20% are Black. The Black squares are the Black household, and the white squares are the white household. So depending on how Blacks and Hispanics are distributed in space, the virus and the potential for interaction, the potential for infection due to the virus might look very different. So given what we know about how members of different racial groups interact with each other, if we know that Blacks and whites don't interact with each other much, if Blacks have a higher likelihood of experiencing the virus might not spread very far along because this, Black household here is not interacting with people around, in the vicinity, so the virus will not travel very far. Whereas if you're in scenario B, where, we have these 5 clusters of Black households, here overall, you should expect to see a higher infection rate because, this virus will spread rapidly in this cluster, also in this cluster, and same for the other 3. And if you have a scenario where there's perfect segregation, where all Black households live in a corner of the city, the virus will spread even faster. So this is the conceptual idea that I have here for how segregation might play a role in producing these massive disparities that we saw during the early stages of the pandemic. In fact, if you look at the literature before COVID, the link between racial segregation and health had been established in several contexts. So it's been shown that places where there is more social isolation and population concentration that's due to racial segregation, in those places we have higher risk of tuberculosis, and HIV tends to spread faster. These are studies from the 80s and 90s, but they were clear in showing that in places where there was more segregation, those infectious diseases tended to spread more rapidly. So I'm not saying anything very new here. I'm just applying the existing literature to the case of COVID-19. So the simple hypothesis I'm going to be testing here is this one. So places where racial segregation is higher, I claim that we'll have higher fatality rates and also larger racial and ethnic gaps in fatality rates. So that's what I'm going to be testing with my data and methodology. So how am I going to do that? So what I did is I collected data at the county level. First on the outcome that I care about here, which is COVID-19 deaths, just looking overall deaths in the population at the county level and also racial and ethnic gaps in deaths. I'm going to be measuring racial segregation at the county level as well, using this metric called relative diversity index. It turns out that there are at least a dozen ways to measure segregation. Different authors have their own particular ways of doing it. It turns out that however you measure segregation in this context, you keep finding the same results. But I went with this one because it's what satisfied the reviewers of the paper. And I'm going to be adding relevant control variables, and I'm bolding here the relevant because it's where the methodology that I'm going to be using here comes into play. The Lasso method. So you'll see more clearly when why I'm highlighting relevant controls here. So the general idea, once this data set has been assembled, is to use regression to estimate the relationship between COVID-19 outcomes and segregation, controlling for as many confounding variables as possible. Closer look at the data. So I ended up having 2,100, almost 2,200 counties in the United States. There are about 3,000 plus counties in the US, but it turns out that most people live in those 2,000 counties. So even though I don't have all counties in the US, I have 96% coverage of the US population. So it means that the counties that I'm not including are rural counties where there is almost no population. So it's a fairly representative sample of the United States. So county level data for fairly representative number of counties. And for each county, I was able to collect data on 50 different factors that could be potentially related to both segregation and COVID-19 infection. So I grouped those 50 factors or controls into 8 categories. Those categories are defined or are informed by existing sociological theories and public health literature. So I look at demographics. It's one bucket of variables. Second one is variables getting at density and potential for public interaction, things like population density, average time that people are commuting. So something that gets at how much interaction in the public exists. Social capital, the level of community institutions in those neighborhoods and counties that foster, social capital in space. Health risk factors like people who had been vaccinated against the flu in the years prior, capacity of the healthcare system, like things like hospitals per capita, doctors per capita, air pollution, which has been shown to be highly correlated with segregation and also potentially impacting COVID outcomes. Share of the population that's employed in essential businesses. The idea here is that in counties where there is a higher share of people who have to show up to work, that might also influence COVID outcomes. And political views. The vaccine was, we all followed the craziness of those early months of the pandemic, but there was all sorts of conspiracy theories going on, reluctance to get vaccinated or not. So I felt that controlling for political views in the county was something that was relevant here. So those are the 8 buckets. So if you count what's in each of those buckets, you end up with 50 variables, which I list here. So, going to looking at the bucket of demographics, I have like percent younger than 25, percent older than 65, a measure of how people are segregated along age lines, racial demographics, so on and so forth. So same for the bucket of density and public interaction. So it's like I'm showing here between these 2 slides, the 50 potential controls that I could include in the model, and showing the correlation that they have with the COVID mortality outcome. Just the correlations here are not relevant. I'm just showing this slide just to show you the list of the 50 variables that are candidates for controls. So this is the data. 50. So the outcome is COVID. what I care about is segregation, and I have 50 other variables that I could include in the model. I could include all of them, but that could be statistically reckless. So if any of you have any prior exposure to regression, you know that this is not something that you should be doing, just throwing everything into the model, because there is potential for overfitting, and it's not, it's not theoretically sound. So I'm going to walk you through how I go about selecting the relevant 50 variables, the relevant variables among the 50 that should feature in the model. But that's coming up in a few slides, so don't get too anxious. So if you forget about controlling about anything else, and you just look at the correlation between COVID outcomes and racial segregation, you find what you would expect given the theoretical framework that I outlined. So this scatter plot, just let's focus on the one on the right. So the x-axis, it's a normalized measure of racial segregation, and the y-axis is a normalized measure of COVID mortality. So each dot represents a county, and the size of the dots represent the population of the county. So bigger dots are bigger counties. So, this big one here is probably New York City, Manhattan. Yeah, so what you find here is a positive correlation between racial segregation and COVID mortality. So places where racial segregation was higher, the fatality rate was higher. So this is the scatter plot on the right. If instead of just looking at that, you just take a broader view and just look at cases, you find the same positive correlation. That's cool. I mean, I don't think that at the time anyone had shown that, but I think we can do better than just simply just doing a simple correlation and not controlling for anything else. So the analytical strategy that I have in mind, just to refine this analysis, is, as I said at the beginning, is use regression analysis to estimate the relationship between county level segregation and county level mortality. So I'm interested in the impact of segregation on COVID mortality. But there are challenges if we're just going to run a simple regression of these two variables. Challenge number one is that there are confounding factors that are potentially driving the relationship between segregation and COVID mortality. So here, the idea of correlation is not causality. It's when it comes into place. So there are things that are both affecting segregation and COVID mortality that, if you don't control for them, are going to be biasing whatever number you get for the association correlation between segregation and COVID mortality. So things like population density. We know that places that are more densely populated tend to be also higher in segregation, and places where population density is higher, COVID mortality will likely be higher. Same, if there is a higher proportion of frontline workers in highly segregated places, frontline workers are more exposed to the virus, then that's a confounding factor. Access to medical care. If places where there is more segregation, there is harder access to medical care, and that also impacts COVID mortality. Failing to account for that, to control for that in the models, will lead to a flawed estimation or a biased result. But the challenge gets even harder because, yes, you have confounding factors. Some of them you can observe and control for, like three that I just mentioned, like population density, frontline workers, access to medical care. You could measure that, and I'm able to measure that and throw that into the model and account for that. So, but there are other factors that are unobservable. There is no way to measure them, like personal networks. I mean, we don't have data on the extent to which people are connected to each other along race or along age lines. The quality of medical care. I can measure the number of doctors, but I cannot measure the quality of those doctors, for example. So there are things just like, I mean, those are not the best examples, I'm realizing, but the idea here is that, there are things that you will never be able to measure and account for. So how do we deal with these two challenges? Remember, challenge number one, there is things that are driving the correlation between segregation and COVID mortality that we should account for. And among these things, there are some that are unobservable. So what's the solution here? So to identify the controls that should be included, to identify the controls among the ones that I can observe that should be included in the model, I'm going to be using what's called the double lasso methodology. And I'm going to walk you through that. To account for the fact that there are things that I will never be able to measure and observe and include in my models, I'll be running some sensitivity analysis. Just to give you a preview of what I mean by sensitivity analysis here is, given that I'm going to be doing some back of the envelope calculation that will get at the following question. Given that I forgot to measure something that could potentially drive the correlation between segregation and COVID mortality, how big that unobserved thing should be to make my results go away? And if it's way bigger than things that are, if it should be way bigger than things that we know are highly correlated with COVID mortality and segregation, we think that this thing is unlikely to exist in the social world. For example, if population density is the thing that correlates the highest with segregation and COVID mortality, and my sensitivity analysis shows that the one thing that would mess up all my models should be 3 times as strong as a population density, I mean, it's unlikely that that thing exists in the real world. Whereas if my sensitivity analysis says you only need something that's 1/10 of population density to make your results go away, then I'm in trouble, because that thing that just 1/10 of population density could be anything in the social world. Is that idea clear? Just what sensitivity analysis are here? Okay, because I'm not going to be talking a lot about sensitivity analysis. I'm going to be spending my time in just going through the double lasso. All right, so now we're getting into the lasso approach that I'm following here. So given this model that I have in mind, so Y is my outcome of interest, which is COVID mortality, racial gaps in COVID mortality, whichever you want. So I'm interested in estimating a model that has an intercept, that's traditional regression analysis, and has a bunch of coefficients here. So one of those coefficients is the one that I really care about, which is the first one. Let's call it beta 1. It's the coefficient of segregation. And then there are a bunch of other controls that I can add. So that's why I'm summing over P potential predictors that I could have here. But there is one that I care a lot about, which is beta 1, controlling the coefficient on racial segregation. So to estimate this model that I have displayed here, I could use OLS. And OLS finds a solution to, so the set of OLS coefficients are the ones that minimize the sum of the squared errors. You taking, the current students in DSML will find this very familiar. They covered that in week 1 or week 2, so very familiar to people. I have another alternative here, which I could, instead of using OLS, I could use lasso regression. Lasso regression looks very similar to OLS, but it adds the penalty term. The penalty term here ensures that the model that I end up with, it's a more parsimonious model. Basically, it penalizes me for having too many controls, and it shrinks some of the controls in size, some of the coefficients in size, will drop some of them. So ultimately, Lasso tends to yield more parsimonious models. And by parsimonious here, I mean that I will have fewer controls in addition to the segregation variable that I care about. Like parsimony tends to be better in general, because less likely to overfit the data, simple to interpret, and it has other appealing properties. The current students in the talk will identify this lambda parameter here, which is the thing that we are tuning via cross validation, and finding the optimal lambda parameter here that yields the most, the better model, so to speak. All right. So the lasso, the way I've explained that, it's a very powerful regression tool, as I said, that yields a parsimonious cross-validated model that will predict the outcome very well. So we'll predict, so my lasso coefficients coming from this minimization problem here will be highly predictive of the outcome. We'll do the very parsimonious model, things that we like when we are just simply doing prediction. But we're not just simply doing prediction. I'm not trying to predict COVID mortality. I'm trying to estimate the role that segregation plays in COVID mortality. So I care a lot about getting right the coefficient on on segregation. So the lasso, it turns out that might harm me instead of helping me. Why? Because as I said at the beginning here, what the lasso does, it will drop some coefficients, it will shrink some others so that we end up with a more parsimonious model. It could be the case that the lasso is shrinking my segregation coefficient towards 0, which will be biased, but it could even drop it altogether because it finds that, you know, segregation should not be here. There is something else that's more powerful than segregation. I'm just going to drop segregation. I mean, the lasso doesn't care about the theory that I have in mind. The lasso doesn't know if I throw all these variables to a lasso regression, the lasso doesn't know that, hey, I care a lot about segregation. Just keep segregation there. The lasso, if you don't do anything else, the lasso will not do that. So you have to do something to ensure that segregation is kept there. And then the shrinkage happens in the other controls that you don't care much about. So how do we take advantage of these very appealing properties of the lasso, of yielding very parsimonious model and still keeping intact the coefficient on segregation? So we do double lasso, not just lasso. How does double lasso work? So going back to the model that I had in mind at the beginning, the one that I used to lay out and set up the whole enterprise here. So I care about the relationship between segregation and mortality, and I know that there are confounding factors. I've put together a data set that has 50 of those potential confounding factors. So what I'm going to do, I mean, what the double lasso does is 4 steps. So the first step, I'll run a simple lasso where I'm going to be predicting segregation from the 50 controls. And because I told you that the lasso is very good at producing very parsimonious models that are cross-validated, of those 50 controls, I'm going to keep some. The lasso regression of segregation on the 50 controls will keep some of them. So step 1, run a lasso of segregation on the 50 controls and keep the ones that the lasso tells me to keep. Step number 2, do the same for COVID. So I'm going to grab my COVID variable, run a lasso on COVID and the 50 controls, and the lasso, because of the way it works, is going to keep some of those 50 controls. So now I have 2 sets of controls. Some of the 50 that I kept from this step number 1, and some of the 50 that I kept from step number 2. Well, I could look at the intersection between the 2, right? I have potentially a pool of controls that intersect, and those are the ones here. So first step is just looking for the ones that were selected by the first lasso and the second lasso, look for overlap, and run a regression of the of COVID-19 on segregation on the double lasso controls. If you're curious about which controls have been selected by the double lasso here, it's a total of 18 controls of the 50 that I throw into the 2 lassos. So the double lasso tells me to keep % Hispanic, % white. Surprisingly, I have to keep sports and bowling centers per capita. Apparently that thing matters for segregation and COVID. I can see why. Hospitals per capita, nursing homes per capita, % of people working from home, % of households with 6 or more occupants, % of individuals with less than no high school, % HIV positive in the population, income segregation, which is a different way of measuring segregation along socioeconomic lines, % younger than 25, % older than 65, % that use public transit to go to work, a measure of air pollution, % of people who got the flu vaccine the year before, % who had health insurance, and median income in the population. So with these 18 controls, now I can do a very simple thing. Just run a simple regression, no more lasso, of COVID mortality on segregation and those 18 controls. This is the optimal set of controls that I should keep to make my model as parsimonious as possible without sacrificing predictive power and without overfitting the data. That's the beauty of the double lasso here. So given that, I ran those models. So for those of you who haven't seen a figure like that, this is a plot of coefficients. So let's focus on the ones at the bottom. So coefficients to the right of the vertical line at 0 means a positive relationship between segregation and the outcome stated at the top. So in this case, the death rate. So I'm going to walk you through what these three rows means. So OLS here means that if you just run a regression of segregation of COVID deaths and segregation without any controls, this is the coefficient that you get. So this means that for a 1 standard deviation change in segregation, the mortality rate increases by 0.36, by 36%. That's a huge amount of change. It's probably confounded by the many things that I'm failing to control. So this is the very naive model, the one for which I showed you the scatter plot, the one that has no control. So, you know, it makes sense that's so big because there are so many other things going on here that are not being accounted for. So here, the second one, what I do is what's called a state fixed effect. So basically I'm running mini regressions within states and averaging across all states. It's better than just doing the simple correlation that I did in the scatter plot. But the good one, the one that I want you to focus on, is the double lasso. This is the results of the regressions where I'm progressing COVID outcome on segregation and the optimal set of controls that the lasso has identified. As you can tell, you know, once you control for things that are relevant, the size of the association shrinks significantly, but it's still statistically significant. So the fact that these horizontal lines are not crossing the vertical line, it means that they're reaching statistical significance. So in practical terms, it means that counties that were 1 standard deviation above the mean of racial segregation experience mortality and infection rates that were 8% higher and 5% higher for infection. If you translate that to what it means in terms of number of people getting infected or dying, so it means that for a 1 standard deviation change in segregation, you get 4 additional deaths or 105 infections in a county with 100,000 residents. So if a county is bigger, you should scale that by the corresponding scaling factor. So for a county with 7, like with a million, it would be 10 times is like 40 deaths and 1,000 additional infections. This is for just looking at deaths without distinguishing between members of different ethnic or racial groups. If you look at the impact of segregation on gaps in mortality between Blacks and whites and Hispanics and whites, you find, just focus on the bottom row, which is the best model, the one that has all the controls that need to be in the model. You find that in counties where there are 1 standard deviation above the Black-white segregation mean, the gap between Blacks and whites was 8% higher. Surprisingly, there is no impact on the gap between Hispanics and whites. I would expect to find an association here. But if you look at the public health literature, this is a very common thing. This is a very common pattern. People have named this. It's called the Hispanic paradox. So paradox comes from the fact that Hispanics and Blacks experience very similar structural conditions of disadvantage, socioeconomic disadvantage, racial segregation, but Hispanics surprisingly do very well in terms of public health outcomes, almost surpassing whites. There are many theories for why this could be the case. People think that Hispanics tend to keep, social bonds that are more conducive to better health outcomes. I mean, this is all speculation that scholars of public health have put out there. But if you just put aside what could be driving this and you just look at the data, Hispanics are doing much better than Blacks in terms of health outcomes, despite facing very similar structural conditions of disadvantage. It's a puzzle that keeps showing up in the public health literature, and it's interestingly, it shows up in this analysis here. So segregation seems not to have an impact on the differences in Hispanic white mortality rates. That's all I have. I mean, here's a figure of I can just walk you through the sensitivity analysis here. So what the sensitivity analysis does here is it plots, this is the contour of variables that could be, if you are any variable that falls in this contour or outside, same for this one, it's a variable that could be sending all my results to trash, meaning no significant association between racial segregation and COVID mortality. The dots here are the variables that are included in the model. So what the scatter plot shows here is the correlation between correlation of the variable that's in the model with the measure of segregation and correlation with the mortality gap. So any variable that it's outside of here means that it's more strongly correlated to segregation and mortality. I find this highly implausible that something that strong exists, given that what's inside this contour here is already highly predictive of segregation. That's why the results make me confident that there is nothing out there that could be driving the correlation that I'm reporting in the models. That's why I think that reviewers like this paper, because it combines this the use of double lasso, which is, of all the things that I could measure, just let the algorithm select the ones that are most highly predictive of both segregation and COVID mortality. And then let me be also vulnerable to having failed to measure something out there and just put a number of how big that something out there should be and compare that to what's already in the model. And what the sensitivity analysis shows is that even if there is something out there, I mean, statistically something could exist, but in practical terms, statistically there is a variable that could make all the results go away. Something that has correlation 0.3 with just like take this one here. So something that has correlation 0.25 with mortality and 0.3 with segregation at the same time, that variable could make everything go away. But it turns out that nothing has these two correlations at the same time. So at least among the things that we can measure. Happy to answer questions. I want to see people's faces better. So
enormous thanks. I know it's not the most easy thing to do remote, but maybe we could all unmute and do a hopeless all round of applause at the same time, because that was a absolutely fascinating talk on a topic that both is very significant, important, on the sort of societal level, and thank you for that, but also in terms of the science, the data science techniques used as well. So I'm going to pass to questions, and I really, really hope it's okay to say, Gerard, where people who are newer to our community, this is not an environment in which, the question of what the heck does that thing mean is a question that's off the table. That is a question very much on the table. So please.
I love these questions. Yeah. So don't if you've never seen a simple regression or anything, just like ask and we'll try to explain it in plain English.
Thank you so much, Gerard. I thought it was super interesting, like your point about how you can't necessarily use lasso regression because it will shrink coefficients. And I thought that's really interesting. I never thought about that before. Like, because in machine learning, we're just trying to predict the outcome as accurately as possible. But in research, we really care about the value of the coefficient. Like we care about what is the effect of this on the outcome. So yeah, and lasso and Ringe really mess with the coefficients. So does that mean that typically when you're doing research, you don't use those regression models unless you're doing something like more sophisticated, like what you did with the double lasso?
I wouldn't call it more sophisticated. It's just like a fundamentally different question that you have in mind. So if you're trying to predict, again, going back to the example I gave one time, if you're trying to predict, so this is like let's say that you could use lasso to predict whether what your self-driving car is seeing in front of you is a stop sign or not. You don't care about, which coefficients are in that model and what's the size of the coefficients. You just care that the prediction is 101% right. So it doesn't matter what's in which the size of the coefficients are being estimated. But for social science, we happen to care about these things because they have policy implications, because we want to build theories around that, because we want to give a precise estimate to, to one coefficient. Then it's when you have to get more creative. It's either you stick to traditional regression or logic regression, where there is no shrinkage happening, or you do things like the double lasso, where you use the predictive power of the lasso to predict the variable that you care about, the outcome, and look for an intersection of the two. And that forces that the coefficient on segregation will be preserved.
Yeah, no, that makes sense. This is super interesting because in sociology, but also in all sorts of fields like economics, pretty much any social science, like you care about the size of the effect of something on the outcome. So
Margaret, there are questions in social science where are purely predictive, and then you might not care about the coefficients. But we tend to, in the social world, we tend to, and in the policy world, we tend to care about bivariate relationships, and some of the machine learning methods, they are very powerful, but you'll have to tweak them somehow to make them work for you in that case.
Awesome, thank you.
Yes. Thank you for the question,
Great.
Margaret.
Next up, Kaju.
Hey, Gerard, thank you for the talk. So I was wondering, I've got two questions. One is, when you showed that 96%, you have accounted for 96% of the population.
Yeah.
What would happen if, say you got 4% of counties that you left out, and some of them are heavily Black, but it's like, they don't have as high of a COVID mortality rate. Would that's the slope of the graph that you had with all the circles, would that tend down, and would that mess with your equation?
Yeah, that's so let me it's a great question. Let me put back the share my screen again. So if you look at one observation here that Kaju just made is that I'm missing 1,000 counties here. So there are 3,000 plus counties in the United States, but those 1,000 counties that haven't been included in the data are only 4% of the population. The reason why I have not included them, it's because they did not have information on the 50 variables that I care about. So I could have included all counties, and instead of measuring 50 things, measure perhaps 25 things. So I chose to measure more things, shrink the size of the counties. It still preserves a lot of the population for which I'm making the inferences. All right, so that's the rationale for why I made that decision. Notice one thing here, Kaju, that those correlations here, or those scatter plots here, are weighted by population. So even if the 1,000 counties that I'm measured were added here, because they're so tiny, you wouldn't even see them in the scatter plot. They would not mess up a lot of my estimation, and probably some of them will fall up here, some of them will fall down here. So just like rural counties that are very heterogeneous. So I did some sensitivity analysis, just running the regressions with full sample of counties with fewer variables, the ones for which I could see for the 3,000 plus counties, and nothing significantly different was happening. But yeah, it's a good observation. It's a good observation, and that's a problem in many social science questions. What happens with the data that you are not including? What happens with the missing data? What happens with the observations that you dropped? At least you have to show us, or at least you have to show some comparison between those that you dropped and those that you kept, and see how different they are from each other, so that readers have an informed way of working through the question that you're asking in this case. Yeah.
Gotcha. So just, I'm in Louisiana, so what you just said.
Oh yeah, at the beginning. Yeah.
I saw it firsthand, and it was, it's, I don't know, it was what it was, I guess. And I have one quick little question, is that how do you define a confounding variable?
Yeah, great question. All right, let's go back to this graph here. So a confounding variable is by definition a variable that it's both related to the variable that you care about and the outcome. In this case, I care about segregation, and the outcome is COVID mortality. Anything that's related to both of them at the same time, that's a confounding factor. A variable that's only related to the outcome or only related to segregation, that's not a confounding factor. If you forget to include that variable, it will not significantly impact the results. Turns out that in the social world, there is not that many things that are not related to everything. But that's like at a conceptual level, that's the idea behind a confounding factor, something that's both related to segregation and COVID mortality in this case.
I see. So would that impact the intersection of the double lasso as well? Like, for example, I know you said something about bowling alleys and sports centers, which I can see, which is where, you know, it's very segregated. So like, that's where people gather. But would that have some effect on that, the confounding factors?
Yes, for sure. Yeah. It will change the pool of, could likely change the pool of confounders. You can never be certain that you've measured all confounding factors, because there are things in the social world that matter, but you can just not measure them. Just like, I don't know, people's attitudes towards vaccines. I mean, we can ask people surveys, but we know that people lie in surveys. So there are things that we don't know, and that's when, you know, sensitivity analysis comes into play. All right, there is something out there that I cannot measure, that I failed to measure, that I forgot to measure, whatever. How big that thing has to be to mess up the whole machinery here? That's the idea.
Wow. Thank you so much.
Thank you for the question, Kaju.
Thanks so much for your presentation. I'm just
Sarah?
curious if there are other methodologies or ways of objectively identifying controls besides the double lasso. And like, in other words, like, if you could do this again, would there be other sort of like mathematical approaches that might yield similar results?
It's a close cousin to the lasso, which we call the ridge regression, but I tend to prefer the lasso. It's more intuitive, and I think that for the shrinkage, I think it works better. I'm not aware of any new development recently that could play a similar role here. The most important one, Sarah, here is just theory, just thinking about the variables and the things that should matter for both segregation and COVID mortality, and make the effort to find information on those things. So of this whole project, like, running the lasso was 10% of the time. 90% of the time was spent on thinking about which things should matter here and going out there and measuring them. That's where the challenge is. And that's where the time in any data science project is spent. So I would say there is no substitute for good theory and good data measurement. And then the methods, they're important, but of course they're important, but it's not where you spend most of the time.
So thank you, Gerard, for that great presentation. I definitely feel enlightened, and I think I speak for the whole room when I say that. I know from base, how did you measure segregation?
Yeah, so I measured in various ways. So the one that I end up including in the models that made it to the paper, it's called the diversity. Blanking on the exact name now. The relative diversity index, which basically captures the probability that two individuals of a different race will interact with each other at the neighborhood level. So the way this is measured from census tract or census block data. So for you to measure segregation at the county level or at the city level, you have to go down to see what's the configuration at the neighborhood level, what proportion of Blacks live in this neighborhood, which other live in that neighborhood, and then just use that data to create the index. You could use the tail index that uses information theory and entropy as well. It turns out that if you use that model, that way of measuring segregation, things don't change. That was my initial proposal, but reviewers asked for this one. You could use what's called a measure of exposure. So what's the percentage of individuals of a given race to which Blacks are exposed in a given city. So just different ways of capturing proximity of individuals of different races.
Okay, great, thank
But
you.
It has to be computed from data that's more disaggregated at the neighborhood level. So you have to see the distribution of people inside the county across neighborhoods.
Right. Okay, great, thank you. I think it's kind of gets to my second question too. So for your sensitivity analysis, you basically had the measure of sensitivity on the x-axis, if I'm not mistaken.
I'm sure again.
Yeah, just do a check. I wasn't quite sure why you chose the two measures that you did for the sensitivity part. Okay.
Yeah, so goes back to this to the question that Kaju asked before. Were you Kaju, the one who asked about sensitivity? Yes.
Yeah.
So goes back to the idea of what's a confounder. Confounder is something that's correlated with both segregation and COVID. That's the thing are problematic here. It's something that has a correlation with COVID and a correlation with segregation. Okay. So that's what I'm plotting here. So I'm plotting what's the correlation of all variables in my model that they have with the mortality gap metric and segregation metric. So just take that dot here. I don't know which variable in the model is this one, but this is a variable that's correlated 0.2 with gaps in COVID mortality positively, and minus 0.2 with segregation.
Okay, understood.
And I do this for all variables in the model, and then I'm plotting the frontier here, outside of which any variable that's outside of that border will cause trouble, so to speak.
Okay. Yes, understood. Okay, thank you.
It's characterizing characterizing how strong these two correlations have to be simultaneously for a confounder to be something problematic. And you can tweak it in different ways, Jonathan. You can, so this sensitivity analysis corresponds to one in which this contour, this frontier here, and anything outside defines the set of variables that, if included in the model, if they existed and were to be included in the model, would make the correlation between segregation and COVID to go to zero. You could take a more conservative approach and say, all right, so I'm going to run a sensitivity analysis to find variables that would cut the magnitude of my association in half, or that would cut it into like 25%. So you could just tweak it in different ways. But this one is the most aggressive version, which is, all right, so let's assume that the correlation between segregation and COVID doesn't exist. It's zero. I'm just making shit up here, or I'm just lucky with the controls that I happen to find. What is this something out there that I haven't measured how big it is? That's the idea here. Okay. Big defined in terms of its correlation with the outcome and segregation.
One more question. So I know you said that you go down to the neighborhood level to get that data about segregation, and now we know that a Black neighborhood it's much less likely to report that kind of stuff, that self-reported race data, than a white neighborhood. So how would that skew your stuff and your segregation measurement?
Yeah. Well, it's a great question, and here we're just relying with what the census tells us. So the data that I'm using for the neighborhood level data that I'm using to compute segregation, it's something that comes from the census. So in theory, the census captures everyone in the country, but it's up to the people who respond to the census to first respond and send back the documentation, and to just be accurate. So this is a potential bug that everyone using census data for demographics has to. But yeah, it's a good observation. But there's not a lot we could do here. But my sense is that on average, the census is it's fairly accurate. It's fairly accurate. There might be pockets where there is underreporting or people failing to comply with whatever the census tells them to submit, but in general, the census is regarded as data that's reliable.
Yeah, it was just interesting when you were saying that, because I saw pockets of like people that were non-diverse, I guess, and I mean, this is of course from experience, but like the conspiracy theories and stuff like that would be kind of spiking up in those pockets because they're not seeing what's outside. But then, like you said, it's much, maybe on average, it's accurate. But then,
but definitely, like if you drill down to particular blocks or particular census tracts, you might find inconsistencies for sure. Yeah.
Thank you, Gerard, so much for sharing your research. That was really, really interesting. And thanks everyone for coming. Keep an eye on our events page for more of these DSML talks. And if you're not part of our Codesmith community yet, check out the DSML page I shared in the chat. We have more workshops, reading groups, pair programming sessions, and more coming up. So keep an eye on that. Thanks again, Gerard, and thanks everybody. Have a good night.